How are you all? Yesterday we have seen what is a normal labor, how a lady is coming to a for normal labor in a hospital, that to the labor room. Actually, she will be having very much anxiety, right? And she is worried, she is having pain. So today we are going to see what is the mechanism of normal labor. To start with, we will see what is the definition of normal mechanism of labor. As the baby is coming down, that means the fetus is coming to the lower part of the uterus and it will be emerged through the genital tract. As the fetus descends, soft tissue and bony structures exert pressure which lead to descent through the birth canal by a series of movements. When the fetus is descending through the birth canal, the pressure will be exerted. As you all know that maximum percentage of the presentation is vertex presentation. That means head is in the lower part of the uterus. Right? Then there are certain principles for mechanism of labor. Let us see what are the different principles of mechanism of labor. First one is descent takes place throughout the labor. I mean to say that whenever the baby is inside the womb, the baby tends to come down. As you all know that baby never will shift back. It will not go back. That means descent takes place throughout the labor. Second one is whichever part leads and first meets the resistance of the pelvic floor will rotate forward until it comes under the symphysis pubis. If you see that the baby is coming down through the birth canal, so the presenting part will always come down and will rotate forward, means the head will rotate forward, not to the back side. That's all. The descent, the leading part, whichever part is meeting the resistance of the pelvic floor will rotate forward, not to the back side, forward, until it comes under the symphysis pubis. Next step is the third step. Whichever part or whatever part emerges from the pelvic will pivot around the symphysis pubis. That means the head has descended and it is under the symphysis pubis. It will come down like this and it will pivot around the symphysis pubis. These are the main three principles of normal mechanism of labor. There are important terminologies. You all might have heard about lie, attitude, all these things. Let us see what is the definition of lie. Lie refers to the relationship of the long axis of the fetus to the long axis of the mother's spine. It can be longitudinal, it can be oblique or it can be transverse. Usually the lie is longitudinal. I'll explain that. The combination of mother's pelvis and mother's long axis and the baby's long axis. It is maximum time the lie is longitudinal and it can be oblique and it can be transverse. Transverse means baby is lying in the transverse position inside the uterus. That means that time the lower part of the uterus will be empty because nothing will be in the lower part. The baby is lying transverse. Many a times this type of cases, patients may not be able to have the normal delivery. Patient may be going for the lower segmental cesarean section. So this is the term called lie. Now comes the attitude. LAPPD. You can learn as an acronym. Lie means this is the relationship of the mother's long axis and the baby's long axis. Attitude is the relationship of different parts of the fetus to one another. Means how the baby's each part is related to one another. As you all know that baby is not straight inside the uterus. It is always flexed, right? The womb inside the womb, baby is in the flexed position. If the baby is in an extended position, head is extended, that means there is chances of obstructed labor. With the flexion only, the movement will be enhancing the progression of labor. So second one is attitude. Usually the attitude maximum percentage the attitude is, what is that? The attitude is flexion, not extension. At times like face presentation and all can be presentation, attitude may be extension. Right? Next is the presentation. Presentation means which part of the fetus occupies the lower pole of the uterus. The uterus is divided into lower pole and the upper division. That is where the lower pole, what occupies inside the lower pole. That is, presentation means part of the fetus which is occupying in the lower pole of the uterus. It is written, examples, it is written cephalic, breech, shoulder. Cephalic means baby's head is in the lower pole. And shoulder means the shoulder is in the lower pole. Breech means baby's back or buttocks is in the lower pole of the uterus. These are the main three presentations. As we had already discussed, the main maximum presentation is the cephalic presentation, or you can say that it is the vertex presentation. Right? Next is the presenting part. The part of the presentation which overlies the internal os. In the cervix, exactly which part is touching the internal os, that is known as presenting part. Like if it is the cephalic, then it will be the vertex, and if it is broad, face in the cephalic presentation. That is, whichever particular part is touching in the internal os of the cervix. Next is the denominator. It is a arbitrary bony fixed point of the presenting part, that we can say